Let's start with a few definitions of our two core topics. Pelvic pain is defined as discomfort in the pelvic region, which is the area between the abdomen and the legs, as shown by the image. This pain is characterized as being constant or episodic, which means that it comes and goes, and it's non-cyclic, which means it doesn't just occur during one's period or menses. Chronic pelvic pain, specifically, is defined as persistent pain that lasts more than 3 to 6 months. Moving on, mental health refers to an individual's psychological and emotional well-being. Mental health disorders occur when there is dysregulation of mood, thinking, and/or behavior to the point of affecting that individual's function. Examples of mental health disorders include depression and anxiety disorders. The reason why we're dedicating an entire video to the topic of pelvic pain and mental health is because a variety of research studies have shown that pelvic pain disorders are closely linked to mood disorders and sleep disorders in women. This essentially means that pelvic pain is linked to problems with mental health. When an individual has a mood disorder, they experience dysfunction in their overall mood, such as abnormally depressed or elevated moods. Examples include depression and anxiety disorders. When an individual has a sleep disorder, they experience problems with the quality, length, and timing of sleep, and an example is insomnia. The reason for the link between pelvic pain and mental health is believed to be due to disruptions in the hypothalamic pituitary adrenal axis, or the HPA axis, and the autonomic nervous system, and these two are basically two systems in the brain that control and execute the body's stress responses. Therefore, chronic pelvic pain influences these systems and affects the body's perception of pain and regulation of stress. The evidence shows that there can be a bidirectional relationship between pelvic pain and mental health disorders. This means that either one can cause the other. For example, a patient may have constant pelvic pain that impairs their life so much that they develop a mental health disorder. Or they may have an underlying mental health disorder that eventually manifests in the form of physical pelvic pain. As mentioned previously, a mental health disorder is defined when dysfunction in your mood, thinking, and/or behavior causes your day-to-day life and functioning to be negatively affected. Therefore, when pelvic pain is associated with mental health problems, this causes the individual to suffer significant problems with work and school, such as not being able to complete deadlines, problems at home, such as not being able to cook, clean, or even get out of bed, and problems with relationships, such as isolating themselves from close family and friends. This graphic from the University of Saskatchewan does an excellent job of showing the mental health continuum in terms of functioning. The green side shows healthy and normal functioning, such as normal sleep patterns, being physically and socially active, and having consistent performance at work or school. The red side shows the level of a clinical mental health disorder, with severe and persistent functional impairments such as persistently depressed mood, not going out or answering emails or phone calls, and having significant difficulty with school or work. And lastly, because mental health is a spectrum, this graphic also shows the levels in between the red and the green, and the differences in functioning at those stages. Let's start with behavioral therapies, which are basically treatments aimed at treating mental health problems by targeting and correcting maladaptive behaviors. First, there's relaxation breathing techniques, for example, box breathing, and here you breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and then hold for 4 seconds. Another example is mindfulness-based stress reduction, or MBSR therapies, which include meditation and yoga-based training to help the mind and body cope with stress. And third, cognitive behavioral therapy is a formalized therapy which involves addressing how your thoughts/cognitions interact with your actions/behaviors and vice versa. Moving on to physical treatments that can help with both the pelvic pain and the mental health aspects, first we have physical therapies with a physiotherapist. Physiotherapy involves targeted exercises that reduce pain and disability and ultimately improve quality of life. Second, you can engage in regular exercise which helps with pain and psychological well-being. It is recommended that individuals start with minimal exercise and then gradually increase in intensity. Third, acupuncture has also been found to provide great relief for chronic pain. Finally, we have drug treatments, which can involve medications that target the pelvic pain, the mental health problems, or even both. These include medications such as neuropathic pain medications, antidepressants, anti-epileptic medications, and analgesics, which include Advil, Tylenol, and opioids. However, at the end of the day, the best course of action is to talk to your healthcare provider first. This may include a family doctor, a psychiatrist, a psychologist, or an OBGYN. They will help determine the best treatment for you and may provide a referral to the specialist if you need it.